Hello everyone, I'm Drew Watts, the Business Development Manager for Restorative Oxygen Care. I'm here with our Medical Director, Dr. James Collier.
Hello.
And we're here in our somewhat new hyperbaric oxygen therapy facility in Lexington, Kentucky. And today we're going to talk a little bit about one of the, the main reasons, the main things that we see in hyperbaric oxygen therapy, and that is the treatment of various wounds.
Correct.
So explain to us a little bit, obviously we see some diabetic wounds we might see and some other types of wounds. Explain a little bit about what makes it a wound and how then hyperbaric oxygen therapy helps with that.
So ultimately what we're doing with hyperbaric oxygen is to try to rescue a wound that is not doing well. Your body naturally heals wounds, but there are things that make it difficult for your body to heal a wound. Number one is infection. Germs are living in there and they're competing with your natural tissues for body resources. So if we can reduce the germ burden, more resources will be available for the tissue itself. Most infective germs that cause us a lot of trouble do not particularly like oxygen. They tolerate it, but they don't like it. Some of them cannot live in the presence of oxygen. So ramping up the oxygen in the tissue tends to kill down the germ burden. The second is that a chronic wound, the tissue has become inflamed. It's chronically angry. It's not working on rebuilding itself. It's just sitting there percolating. So hyperbaric oxygen will diminish inflammation and let the tissue move more towards normal. Finally, we want the wound to heal. We want it to close. We want the tissue to reform itself as it used to be. And that depends very much on blood flow in order to bring in the supplies that are needed to rebuild. And as part of that, hyperbaric oxygen actually induces the creation of new blood channels that were not there before.
Right. And so is hyperbaric oxygen therapy something, let's say we're treating a wound, is it something that's done as a standalone, or do we work as part of a team with other
Almost always, hyperbaric should be part of a team approach. There should be people who are knowledgeable and dedicated to actual wound care. Nutrition plays a part, control of things like diabetes or other inflammatory properties. There's just many factors to getting especially stubborn chronic wounds to heal that require a team approach.
Right. And that's one of the fantastic things I think about our medical staff here is that we have very good relationships with many of the providers that we work with, but patient outcomes are always our number one priority. Well, safety, I guess, number one, outcome number two. But yes, we're always working, making sure that we're doing what's in the best interest for the patient to get the best outcome, and doing whatever means that is necessary to involve other providers and their specialties as well. Okay, anything else you need to add about wounds?
Don't think so this time.
Okay, well, if you have any questions about wounds, chronic wounds, diabetic wounds that may not be healing, you can check out our website or give us a call at the phone number below, and we'll be happy to answer your questions and, if necessary, have you come in for your initial consultation. Thank you so much.